Good day everyone, my name is Chris. So for today, I will be assessing body temperature. The purpose of this assessment is to establish a baseline data for um, subsequent evaluation. Next is to identify whether the core temperature is within the normal range. And another one is to determine the changes of the core temperature in response to specific therapies. And lastly, we need to monitor the patients at risk for imbalanced body temperature. So let us proceed to the assessment for the patient. We need to assess the patient for number one, significant ear drainage or scarred tympanic membrane. Number two, cognitive functioning is intact. The patient may close his or her lips around the thermometer. If the patient cannot, the oral method is not appropriate. So the next one is the rectal temperature. We need to review the patient's most recent platelet count. Also, we do know that the rectum is very vascular, so inserting a thermometer could cause rectal bleeding. Next is the axillary temperature. We need to assess the patient of his or her ability to hold the arms against his or her body. And lastly, the temporal artery temperature. We need to assess head coverings. So we need to proceed to the implementations. So the first one is to check the doctor's or the physician's order or nursing care plan for frequency and route. Number two is to introduce yourself to the patient and verify the patient's identity. So here is an example. Hi, my name is Chris. I will be your nurse for today. May I know your name? Okay, Miss Love. The next step is you need to explain the procedure to the patient, and you need to assess the patient's ability to assist with the procedure. And the next step is to gather the equipment. We need to ensure that the equipments or the electronics or digital thermometers are in good condition or in working condition. And the next step is we need to provide some privacy. We need to close the curtains around the bed and close the doors to room if possible. Next is we need to perform hand hygiene. We need to put on gloves if appropriate or indicated. Lastly is we need to select the proper appropriate site and the appropriate type of thermometer. So let us move on to measuring a tympanic membrane temperature. So the first step is, if necessary, push the on button and wait for the ready signal of the unit. Number two is we need to attach the tympanic probe cover. Next is we need to insert the probe snugly into the external ear of the patient with gentle and firm pressure, and angling the thermometer towards the patient's jawline. Also, we need to pull the pinna up and back for an adult, and for children, we need to pull the pinna pinna down and back to straighten the ear canal of the patients. For our step number 4, we need to activate the thermometer by pushing the trigger button. The reading is immediate, usually within 2 seconds. So after we got the readings, we need to note the readings. So Ma'am Love, you got 36.4 degrees Celsius, and that's within the normal range of body temperature. Now, for our last step from the tympanic membrane temperature is we need to dispose the probe covering by holding the probe in an appropriate receptacle and by pressing the probe release button, or use the rim of cover to remove from probe. And lastly, we need to replace the thermometer to its charger if necessary. Now let us proceed to the oral, assessing the oral temperature. So the first step is we need to remove the electronic unit from the charging unit, and also we need to remove the probe from the recording unit. So we need to cover the probe with disposable probe covering, and we need to slide it on and let it snap in place. So the next step is we need to place the probe beneath the patient's tongue and in the posterior sublingual pocket, and we need to ask the patient to close his or her lips around the thermometer. Ma'am, can you open your mouth? So for our fourth step is we need to continue holding the thermometer until we hear a beep. Let us imagine that we have already heard the beep. After that, we need to note the temperature. Ma'am, you have a 36.4 degrees Celsius of body temperature, and that is within the normal range. So for our fifth step, we need to remove the probe from the patient's mouth. We have already done it. And we need to dispose the probe covering by holding the probe over an appropriate receptacle and pushing the probe release button. For our step number 6, we need to return the probe to its storage place within the unit, and we need to return the electronic unit from its charging unit. So let us proceed to the rectal body temperature, assessing the rectal temperature. So for our first step, we need to place the bed in a appropriate working height, and we need to put on non-sterile gloves. Let's assume that we have already adjusted the bed. in an appropriate height. Next thing to do is we need to put on non-sterile gloves. For our second step, we need to assist the patient uh, or we need to assist the patient to a side lying position. The next one is we need to pull back the cover enough to expose the buttocks. Ma'am, I will now remove uh, this portion so I can see uh, your buttocks area. So for our third step, we need to remove the rectal probe into the mm, reading unit, recording unit of the um, electronic temperature and electronic thermometer. And next step is we need to cover the uh, thermometer probe with disposable probe cover and sliding it on and letting it snap into place. So our fourth step is we need to lubricate about 1 inch of the probe. So for our fifth step is we need to reassure the patient and separate the buttocks until the anal sphincter is visible and can clearly be seen. Ma'am, I will now proceed in the insertion of the thermometer in your buttocks area. So please relax. Our sixth step is we need to insert the thermometer in the anus and for about 1.5 inch in an adult and a 1 inch for children. Ma'am, I am about to insert it now, the thermometer. You may feel a little bit discomfort, so please relax. So for the seventh step, we need to hold the thermometer until we hear a beep. Assuming that we already heard the beep, we need to remove the thermometer carefully. Ma'am, the temperature, I am about to withdraw the thermometer. You may feel again another discomfort, a little bit discomfort, so please relax. After that, after removing the thermometer, we need to note the temperature reading. Ma'am Love, you've got a 36.5 degrees Celsius uh, rectal temperature, and that is still in the normal range of body temperature. So for our 8th step, we need to dispose the probe cover by holding the probe in a appropriate receptacle and pushing the uh, probe release button. So for our 9th step, using a toilet tissue or a toilet paper, we need to wipe the anus of the patient for uh, feces and for the excess lubricant. Next thing you do is you need to dispose the tissue. So for our 10th step, we need to cover the patient and help the patient to a position of comfort. I will now, ma'am, I will now return the position of your clothes. So for our 11th step, we need to remove our gloves and perform a hand hygiene. So for our 12th step, we need to place the bed in the lowest position. Also, we need to elevate the rails and as needed. So assuming that we have already lowered or adjust the bed, we need to proceed to the 13th step, and we need to return the thermometer to its charging unit. Now we will proceed to the auxiliary, assessing the auxiliary temperature. The first thing we need to do is, again, we need to place the bed in a appropriate working height. So again, we will assume that we have already adjusted the bed. Now we will move on to the second step, which is we need to move the patient's clothes um, uh, to only exposing his or her axilia. So we have already moved the patient's clothes. We will now proceed to our step 3, which is we need to remove the probe from the recording unit of the electronic electronic thermometer, and we will now again put the cover of the probe or the thermometer. We will need a disposable probe cover and put it. We need to put the probe cover in the thermometer. We need to slide it on and let it snap in place. Now that we have already put the cover of the probe, we will now proceed to the step 4, and that is we will need to place the end or the tip of the thermometer to the center of the axilia. Have the patient bring the arm down and and near the near or near the body or close to the body. Number five, uh, we need to hold the thermometer in place until we hear a beep. So assuming we have already heard the beep, we need to remove um, the thermometer carefully. Ma'am, I will now remove the thermometer. The next thing we do is we need to note that we need to note the temperature reading of the thermometer. Ma'am, you have a 36.2 degrees Celsius of axillary temperature, and that is again in the normal range of a body temperature. So for our sixth step is we need to cover the patient, and we need to help his or her uh, to a position of comfort. So that the patient is now comfortable with his position, we need to proceed to the seventh step is again we need to dispose the probe cover uh, by holding the probe over an appropriate receptacle and pushing the probe release button. So for our eighth step, we need to place again the uh, bed in the lowest position, and we need to again elevate the rail as needed. Assuming that we have already adjusted again the table, I mean the bed, uh, we need to proceed to step 9, which is return the probe into its charging unit. So for our 10th step, when the uh, measurement is complete, we need to remove our gloves if used. So we didn't use a gloves in this instance. So we need to perform our hand hygiene. So for our evaluation, the patient's temperature is assisted accurately with no injury. The patient experienced minimal discomfort. So for our uh, documentation or yes, documentation, first is we need to record the temperature uh, on the paper, on the flow sheets, or in the computerized records. Second is we need to report abnormal findings to the appropriate person. And the last one is we need to identify the site of the assessment uh, of the if the other um, we need to identify the site of the assessment if the other uh, than the oral. Yes. Thank you.